Hello, I'm Dr. Ken Sharlin, and you're listening or viewing the Parkinson Solution Summit. Today, I am truly honored to welcome a very dear friend, a fine physician, an outstanding researcher who truly bridges both the conventional and the functional integrative medicine world with her work in multiple sclerosis and really helping to dig down deep into the root causes of disease, helping people affected by neurodegenerative disorders, including Parkinson's disease, to change their disease trajectory. I can think of no other person in the world who gives so many people and empowers them to change what they have been told about how their disease outcome can go than Dr. Terry Wahls.
So in 2000, out walking with my wife, Jack, a half mile from home, my left leg grows weak. Dragging it, I hobble home. I see the neurologist who says, Terry, this could be bad or really, really bad. And so we begin the workup over the next 3 weeks. And during that time, I think about the fact I've had 20 years of worsening electrical face pain. So I know I have a progressive disorder. I don't want to become disabled. So actually, I'm secretly praying for a rapidly fatal diagnosis. 3 weeks later, I get my spinal tap, all my MRIs, EMGs, and I hear the words multiple sclerosis. I do my research, find the best MS center in the country, take the newest drugs, and 3 years later, I hear tilt recline wheelchair, which I get. My face pains continue to worsen. Tears run down my face as my 10-year-old daughter Zeb hugs me. I decide to go back to reading the basic science. I go to PubMed night after night. I decide that mitochondria dysfunction drive disability. And so I create a supplement cocktail for my mitochondria, and the speed of my decline slows. I discover a study using electrical stimulation of muscles. I convince my physical therapist to let me try it. He calls it E-stim. He says it's for athletes and that it's painful. But he does give me a test session. And Ken, it hurts like hell.
Oh, no.
But when it's over, I feel really great. He says it's because of all of the endorphins from the E-stim, and we add that to my physical therapy. At that same time, I discovered the Institute for Functional Medicine. I take their course on neuroprotection. I now have a longer list of supplements, which I add. And then I have a really big aha, and I'm sort of embarrassed by how long it took me to have this aha. Like, what if I redesign the paleo diet that I've been following for the last 5 years, yet figure out what all these things I'm taking in supplement form, where they are in the food supply. December 26th, I redesigned my paleo diet in a very structured way. For all of your listeners, I want you to understand that at that point, and I have profound fatigue by 10 in the morning. I'm in a zero gravity chair with my knees higher than my nose because I can't sit up anymore more than 10 minutes. So I'm in that zero grav chair, or I'm in bed. I can take just a couple steps with 2 walking sticks, or I'm in the tilt recline wheelchair. I've come to terms with that. I'm going to be bedridden by my illness. I'm probably going to become demented by my illness, and my trigeminal neuralgia, which has been turning on, is much more difficult to turn off, is on track to become permanently on. And when it's on, a breeze triggers the pain, light triggers the pain, sound triggers the pain, chewing triggers the pain, swallowing triggers the pain, and talking triggers the pain. So if I try to talk, it sort of sounds like this. I can only get just a brief syllable out because the pain becomes so intense. I can't get 2 syllables out. So I rewrite my medical power of attorney and my living will such that if I get to the point where I quit talking and quit eating, there's no feeding tube and no IV fluids. So very, very grim future. I start this new way of eating December 26th. A month later, and this is stunning, I tell Jackie I would like to sit in a regular chair for supper. And I can sit up for supper, the first time in years. I begin walking with walking sticks at the hospital, stunning my colleagues. And then I walk with 1 walking stick and then with no walking sticks. On Mother's Day, I tell my family I really want to try riding my bike. And now this is 8 months of E-stim, 6 months of the new diet. There's an emergency family meeting. Jackie has Zach, my 6'5" son, jog alongside on the left. My daughter Zeb's going to jog alongside on the right, and Jackie will follow. And I get on my bike and I bike around the block. That big 16-year-old boy, he's crying. My 13-year-old daughter, she's crying. And Jackie's crying. And when I talk about this, I cry, even now. Because it was at that moment that my understanding of disease and health was really transformed. And that's when I understood that who knows how much recovery might be possible. I biked a little bit more every day. And in October, Jackie said, let's sign you up for the Courage Ride 18.5 miles. When I crossed that finish line, my kids are crying, Jackie's crying, I'm crying. And this fundamentally changes me. It changes how I think about disease and health. It will change the way I practice medicine. And it will ultimately change my research and my mission, which is to teach people that there's a lot you can do to change the course of your illness.
First of all, I do want to let our viewers know that mitochondria power our cells, and mitochondria, which evolutionarily were probably separate organisms but became incorporated into our cells, really do their work because of the food that we eat. They are supported by nutrition and they can't function without nutrition, so that the person with MS and Parkinson's disease, because fatigue is a very common symptom in Parkinson's as well, they don't have the energy.
When I'm diagnosed, my children are very young, 8 and 5. At that point, I was still athletic, and pretty rapidly I'm not athletic, and then severely disabled. And I kept having to reimagine what it meant to be a parent, a life partner. And one of the things, I had grown up on a farm, so we had lots of chores that you had to do, and you really understood that your work was integral to the farm. And I knew my kids would have to have chores. I thought deeply that what's the most important thing that matters to me, and that was that my children would learn how to be successful. And that life is not fair. Life is hard, and I could either give in to the despair that I felt, and I felt plenty of despair, plenty of despair, or I could keep doing the best that I could every day because my kids were watching. They were going to model whatever it was that I was doing. And so I did my little workout every day. And then when I figured out that food really mattered, it's like we're going to do the best we can with food. That's what mattered to me, was showing my kids that, yep, life is hard, but so what? You keep doing the best you can. And that's something I talk to my patients about, is all of our choices will be absorbed by the people around us. And we can either give in to our despair, or we could keep doing the best we can with the next little actionable step that we can take to improve our diet, or work on our stress management, or work on our exercise program. And we talk about those three domains. Pick one and keep making little progress, and be a model to inspire your family. There's a bunch of research for the Mediterranean diet that has been very favorable, and that is a great diet. About 85,000 generations of humans eating the paleo diet, which are greens, leafy vegetables, some berries, some starchy tubers, and meat, fish, poultry. That's how we evolved eating. And then only about 100 generations of people eating legumes, grains, and dairy. And there are many versions of the paleo diet because there are many ecosystems in the world. We have much more confidence in that diet. Now, scientifically, since my first case study, which was published in 2010, and we've done most of them using the paleo diet, looking at outcomes in relapse remitted MS, progressive MS, it's consistently showing reduced fatigue, improved quality of life, and improved motor function. The paleo diet had the highest effect size for reducing fatigue, improving quality of life, and was better than the Mediterranean diet by almost twice as effective as the Mediterranean diet for improving quality of life, and 50% more effective than the Mediterranean or low-fat diet for reducing fatigue. I tell my patients, do this as a family intervention. If you want the biggest effect, you do the paleo diet. If that's too hard, but the Mediterranean diet is what you can do, start there. If that's too hard, just work on improving your diet step by step. I usually work on the ads, getting more non-starchy vegetables. A lovely thing to do is to take some cooking classes to learn how to make some salads or soups. I really like one-pot skillet meals because I want the things that you make to be easy. We had a therapeutic lifestyle clinic at the VA where we took all sorts of people with autoimmune diseases, with some cognitive decline issues, with some Parkinson's, and a variety of psychiatric problems. They still had remarkable reduction in fatigue, remarkable improvement in quality of life. I really think I'd rather have the vast majority stay at level 2 at Wahls Paleo. Keto diets can be super helpful for people with seizures, people with cancer, and people with significant cognitive decline and dementias. But you have to watch that very carefully, because when I put someone in ketosis, part of the signals that my body is seeing is like, okay, I'm in starvation mode. I'm going to adjust my hormonal balance to that starvation mode, be a little more conservative. It'll be harder to get pregnant. I'll be a little bit more vulnerable to infections. And historically, humans were in ketosis for much of our evolutionary history. But we're in ketosis because of exercise, not because of a high-fat diet. We're in ketosis because it took that much work to get our food. Then we would eat, we'd have successful hunt, successful gathering. We would have plenty of food for a few days. We'd be out of ketosis. We wouldn't be working so hard because we had our food. And then we'd have to go out and get our food again. So we're back in ketosis on the basis of exercise. From an evolutionary standpoint, I think there's more evidence that being in ketosis for maybe a week and then being out of ketosis for maybe. And so going back and forth, that metabolic flexibility is what I'd prefer that people do. I expect superior to long-term ketosis. However, people with seizure disorders, I may leave them in long-term ketosis. People with cancer, I'll have them in ketosis as they go through all of their cancer treatment.
And at the cellular level, there are certain things that happen during ketosis, things like the ability of your immune system to go and clean up old, worn-out cells, old, worn-out mitochondria. But then with the refeeding, the introduction of a little more carbohydrates, at least the more complex carbohydrates that our bodies can thrive on to produce things like short-chain fatty acids, then there is sort of a regenerative effect of the shift from a ketogenic diet back to a Wahls level 2.
And during that time, I want to be sure that all of your listeners know this. So I go into ketosis, and then when I refeed a little more protein, a little more carbs, I release more stem cells. And I have a little more protein in my diet. So as the stem cells are saying, okay, time to rebuild, I have the building blocks to do that rebuilding. And that's what I do personally. I'm in ketosis, and then I have a little higher protein, a little higher carb diet for the rebuilding phase, and then I'm back in ketosis.
I have worked with so many patients who follow Dr. Wahls and follow the Wahls Protocol, and it has transformed so many people's lives.
So my website's Terry Wahls, Terry, Wahls, WAHLS.com. And when you go there, you can sign up for my newsletters, get our research updates. And I would also encourage you to follow me on Instagram at Dr. Terry Wahls. You'll see what I'm eating and doing, get lots of fun tips and inspiration. And if you have multiple sclerosis, look at our research website, terrywahls.com/MS study, and screen and participate, be part of our patient registry for future studies, or enroll in the current study.